Now, the government has ordered over 90,000 doses of foot and mouth disease vaccines, with the first batch expected to arrive this week. This comes after the Southern African Agri Initiative raised alarms about the growing number of farmers struggling financially due to their inability to sell livestock. The crisis stems from the foot and mouth disease outbreak that began in KwaZulu-Natal in December 2024 and has since spread to major feedlots nationwide. Now, for more on this matter, we are joined by the CEO of the Southern African Agri Initiative, Francois Rossouw. Francois, thank you. We really appreciate your time with this.
Good morning.
I think the best starting point at this stage is to outline how bad the situation actually has been and the timeline of the crisis and how far it's actually spread now.
Yeah, so the initial outbreak was recorded on 30th of May at South Africa's biggest feedlot in Heidelberg at the Karen facility. And 4,500 out of the 120,000 cattle that are hosted there were infected, and all cattle intake and export of beef was then immediately halted. Currently, we know there is a very big disaster management area in the KwaZulu-Natal area, which has been there since December because of the amount of outbreaks that are reported there, almost just over 150. But the Heidelberg incident was a real knock to the system, and that is why you are seeing such urgency, is because, you know, this is a very reputable feedlot with extremely good biosecurity controls, and it also affects a lot of farmers downstream as they deliver to this facility. The biggest knock is, of course, immediately to the farmers as they are unable to deliver to this facility, and of course all our exports to China have been immediately halted. This will now cause in the very short term, a increase of red meat onto the shelves, which will mean lower prices in the short term, and then in the longer term, as farmers keep their weaner calves away, because of this lack of being able to deliver and the lower prices, it will mean an increase in prices in the longer term.
Sure, and that's a great worry. It really is, because already people struggling at this point in time, whether we talk about the price of things increasing at a rapid rate. So now to expect it on meat is also one that South Africans, I don't think, can afford at this point. You have described this as one of the most economically damaging outbreaks that we have seen so far. Perhaps you can actually quantify the number of farms and the head of cattle that have been affected so far.
Yeah, so we still don't know the exact extent of the problem. The real threat is what does it mean if a feedlot like Karen is already infected? In South Africa, we have about 14 million cattle, half of which is cattle which belong to the rural communities and developing farmers. Now, they don't have these type of biological control measures. They don't have access to vaccines. And this is a highly communicable disease, and it spreads very easily through the transport and the contact of livestock. It can spread through infected hay. We don't know what the extent of the problem is, but the fact that it was reported in a reputable feedlot like this means we need to be extremely concerned. And what concerns me the most is that since 2021, our biological safety when it comes to diseases in livestock has really it's gotten worse and worse with the outbreak of foot and mouth disease, avian influenza, swine flu, and we just don't see any urgency from government in addressing this.
Yeah, and that's where I wanted to now come in and discuss that, because my question is, what is the response of government? And you are saying we haven't seen the urgency that is required. In fact, we opened up the conversation saying that the government has ordered over 90,000 doses. Is this enough? When we're talking about how wide this is, do you think that this can assist?
Yeah, first of all, it's important that your viewers realize that foot and mouth disease is a state-controlled disease, meaning that the government has statutory powers and legal authority, when it comes to the management of this disease. As farmers, we have realized that it's not in our power to control this disease. We can only manage it because it is now endemic to South Africa. But it's actually extremely embarrassing that we have to order 90,000 vaccines from Botswana, which will only give us about 3 months worth of protection. Where if we manufactured it locally at Onderstepoort Biological Products, who was once, the best laboratory in Africa. But as another state-owned enterprise, that production facility has just gone totally awry because of mismanagement and corruption. But now we have to order in vaccines from another country who does not have the same strains as we do, which gives us very limited protection, where if we produced it ourselves, we would have had 6 to 12 months of protection. So this is the type of things that are really worrying me. And we've had, the minister has said for the past 10 months that he's investigating what happened to the 500 million rand lost at OBP. And, they will get to the bottom of this and we're going to restart production. We just have not. We are not producing our own foot and mouth disease vaccines. We are not producing our own African horse sickness vaccines. Yeah. And this is going to lead to a pandemic very soon.
Yeah, indeed. I mean, there are actually growing calls by some cattle producers to declare a state of disaster on this and to protect the industry from financial ruin. You obviously are joining that call. Do you think that this is the way we need to go right now?
Yes, you see, the problem is once a DMA is announced, farmers cannot move their cattle in that area. The cattle cannot be slaughtered. And this is the only income for most of these farmers, meaning that there's no way to pay wages, the electricity bill, or buy food. So you make criminals out of farmers by forcing them to move their cattle in an area which is basically under quarantine, and they are not allowed to move it. So for us, it is extremely important that there is immediate action and that these areas are quarantined, but that alternative solutions are given to farmers on how to get an income for themselves.
Now, I mean, when we look at what's going on here, I mean, you've got South Africa lost its FMD-free status with the World Organization for Animal Health in 2019, hasn't regained it. The lack of FMD-free status surely has limited export opportunities, especially in the EU and the Middle East. And now, with what we're seeing happening now, I mean, there's no chance that we will regain that status, surely. I mean, how detrimental is this for the image of South African meat products and beef? I mean, I'm not talking about what's local, because that already, I think we've spoken about in terms of the price increases and what's going to happen. But internationally, where many people rely on this as a livelihood, what are we seeing happening?
Yeah, first of all, I don't see us getting back our foot and mouth disease free status anytime soon. We have had 288 outbreaks and maybe more since 2021. Yeah. Only recently, Brazil was able to regain their foot and mouth disease free status after 70 years and extreme intervention. Again, countries like Namibia and Botswana, they have gotten these type of biological disease controls that we do not have. And they are able to export their red meat as some of the best in the world because, they have realized what this means to their economy, what this means to their farmers. This just means that we are not going to hit our targets. We are not going to grow the red meat industry or the sector within the foreseeable future, as this will just mean that with all the other issues that farmers are having, rising input costs, cattle theft, lacking municipal infrastructure, that it's not going to be profitable to farm cattle in the future. And if you're not able to farm profitably, you are not going to invest in that industry. Farming is not a welfare enterprise. It's a business. And if you can't make a profit, you are going to stop with that business.
Yeah. And I mean, I know we've spoken about this, the current beef. I mean, this is the country's largest feedlot and one of the world's biggest. And you say that they've got sophisticated mechanisms to try and protect this. And yet, it still happened, and it's still a very disruptive thing to happen to the supply of beef. Now, I mean, the agriculture sector is the biggest contributor to the GDP growth of the first quarter. We saw those numbers coming out. I mean, this is going to impact us going forward for the growth of this country that desperately needs it in this economic times.
Yes, definitely. Luckily, it looks like we're going to have a good harvest season, but something like this really quells the whole industry. Like I said, we are deeply concerned, not only at the fact that we've got this F&D outbreak at the moment, but there was also a outbreak of avian influenza in Brazil, halting the import of boneless chicken products, which is immensely important for especially the lower income parts of South Africa. So it's not just what agriculture produces, but it's also having a direct effect on consumers. Consumers will be paying more, and it's not just that they are able to switch from one protein to another, because at the moment, basically all of them are under attack by some way or another via disease.
Talk to me about the process going forward once those vaccines arrive in the country, priority areas. How are they going to be distributed? Talk to us about that.
Yeah, so the Red Meat Industry Services is setting up a operations center actually starting from today. So they are creating a 3-month response framework, and they will be coordinating with the Joint Operations Center, and they will be evaluating these areas, the outbreaks, working closely with private veterinarians, state veterinarians, and then they will decide what the plan will be. They will also be evaluating and enhancing the government contingency plan, which was only recently received after asking for it for years. And then it's important that there are very good public-private partnerships between state and private bodies and institutions. I think the most important thing that's not being taken up seriously enough is the fact that we need enforcement. If we declare a DMA area which is under quarantine, it should be enforced by having blockades that are manned by either police or the army, but we need to stop the transport of infected animals, because you create a dire situation in an area where farmers are not allowed to move their cattle, but in order for them to survive, they do move it. And if some of them are infected, they move them to a feedlot or another area where there are other cattle, and they infect them, and those cattle go to other areas. So we need to urgently have roadblocks where we check permits and the health status of these different animals to ensure that they are not moved across DMA lines. And that's the most important at the moment.
All right, we wish you luck. It is a very, very urgent matter that needs to be dealt with. But Francois Rossouw, the CEO of the Southern African Agri Initiative, giving us more about this foot and mouth disease outbreak crisis, truly, that is affecting farmers at this point in time.